7 symptoms that can't be ignored after 60. Even if everything is fine. Symptom number 1. Sudden weakness or fatigue. I'm just tired. It's probably my age. I've been doing too much. These are common phrases older adults say when they feel unusually weak or exhausted. But here's the truth. Sudden or ongoing fatigue is not just part of getting older, it can be a warning sign of something serious going on inside the body. This kind of fatigue may show up as feeling like your legs are too heavy to walk, needing to lie down after simple chores, struggling to get out of bed, even after a full night's sleep, getting winded or sweaty after mild activity, losing motivation to do things you used to enjoy. If this sounds familiar, don't brush it off. There are several possible medical reasons behind unexplained fatigue. Anemia. Low red blood cell count means your body isn't getting enough oxygen, causing weakness, pale skin, and lightheadedness. Heart problems. Conditions like heart failure don't always begin with chest pain. Fatigue is often an early warning sign that the heart is struggling to pump efficiently. Diabetes or blood sugar issues. High or low blood sugar can drain your energy, especially if paired with thirst, frequent urination, or blurry vision. Thyroid disorders. A slow thyroid, hypothyroidism, leads to fatigue, weight gain, and brain fog, and is common in older adults. Cancer or chronic infections. Unexplained, lasting fatigue can be one of the first symptoms of underlying disease. In all of these cases, the earlier the issue is caught, the better the outcome. But many seniors delay seeing a doctor, thinking it's normal to feel tired all the time. Here's the bottom line. It is not normal to feel exhausted every day. It is not normal to run out of energy doing light housework. It is not normal to sleep all night and wake up already worn out. If you've noticed a big drop in your energy, don't wait. Talk to your doctor, get some basic blood work done, and find out what your body is trying to tell you. Sometimes the solution is simple, but ignoring it can be dangerous. Symptom number 2. Unexplained weight loss. Losing a few pounds on purpose is one thing. But when the weight drops without trying, especially after age 60, it's a red flag. If your clothes suddenly feel loose, your face looks thinner, or the number on the scale keeps falling for no clear reason, it's time to pay attention. Many older adults think, I must be eating less, or maybe it's stress. But in reality, unintentional weight loss can be one of the earliest signs of serious illness. How much is too much? Medical guidelines say that losing more than 4-5 kilograms, about 10 pounds, over 6-12 months without dieting or increasing physical activity is a reason to see a doctor. Possible causes of sudden weight loss in seniors. Digestive disorders. Conditions like ulcers, inflammation, or poor absorption, e.g. Celiac disease, can prevent your body from taking in nutrients, even if you eat well. Cancer. Certain types of cancer, especially in the stomach, pancreas, lungs, or colon, often begin silently, with weight loss as one of the first signs. Depression or anxiety. Mental health affects appetite. Seniors who are lonely, grieving, or overwhelmed may eat less without realizing it. Thyroid problems. Hyperthyroidism, an overactive thyroid speeds up your metabolism, leading to rapid weight loss, irritability, and even heart issues. Diabetes. In some cases, high blood sugar causes the body to burn fat and muscle for energy, resulting in unexplained weight loss. Medications. Some drugs can reduce appetite, alter taste, or cause nausea. Common culprits include certain antidepressants, diuretics, or treatments for Parkinson's or dementia. Real-life clue. If you're not eating differently, not exercising more, and still losing weight, your body is burning energy without permission. That means something might be wrong internally. What to do? Weigh yourself regularly, or pay attention to how your clothes fit. Track your eating habits for a few days. Are you eating enough? Tell your doctor if you've lost more than 4-5 kilograms without trying. Ask about blood tests, thyroid checks, or imaging if needed. Bottom line. Weight loss is not always a good thing. At an older age, losing muscle and fat too quickly weakens the body, increases the risk of falls, infections, and poor healing. Don't ignore it. Catch the cause early, and you may prevent something far more serious. Symptom number 3. Memory loss that gets worse over time. It's normal to forget where you put your glasses once in a while. But when memory problems start getting worse, interfere with your daily life, or make others concerned, it's time to take it seriously. After 60, some changes in memory and focus are expected. You might take a bit longer to recall a word or need to write things down more often. But here's the key difference. Normal aging equals slower recall, warning sign equals memory loss that disrupts your daily routine, signs that memory issues are not normal. Forgetting names of close family or longtime friends, repeating the same question or story within minutes, getting lost in familiar places, missing appointments, even with reminders, trouble following a conversation or recipe, confusion about dates, time, or where you are. These signs may point to mild cognitive impairment, MCI, or even early-stage dementia, including Alzheimer's disease. According to the Alzheimer's Association, 1 in 9 people over 65 has some form of dementia, but many go undiagnosed for years because the symptoms are mistaken for just getting older. Other possible causes of memory problems: medication side effects. Certain drugs for sleep, anxiety, or blood pressure can impair memory. Depression in older adults. Depression often looks like forgetfulness or confusion. Vitamin B12 deficiency. Low B12 affects brain function and is common in seniors. Thyroid imbalance. Both overactive and underactive thyroid can cloud thinking. Small strokes often go unnoticed but cause gradual memory decline. What to do if you notice worsening memory? Write down specific examples. What's happening, how often, how it affects you. Talk to someone you trust. Sometimes others notice memory problems before we do. See a doctor. There are memory tests, blood work, and brain scans that can help find the cause. Start early. Treatments, support, and lifestyle changes are more effective when started early. Final note: memory loss is not just a part of aging to be accepted. It's a signal that the brain may need attention. Whether the cause is physical, emotional, or neurological, you deserve answers and help. Getting checked doesn't mean something is wrong, it means you're taking care of your mind, just like you would your heart or your bones. Symptom number 4. Shortness of breath during simple activity. You're walking across the room, tying your shoes, or climbing one flight of stairs, and suddenly, you're out of breath. You pause, your chest feels tight, your breathing speeds up. You think, maybe I'm just out of shape. But here's the truth. If you find yourself short of breath during everyday activities, it's not normal aging, it's a warning. Why the symptom matters: shortness of breath, called dyspnea, can point to problems in your heart, lungs, or blood. At rest, you might feel fine, but when your body needs more oxygen, these hidden issues become visible. This kind of breathlessness may show up as needing to stop while walking, breathing heavily after light chores, feeling like you can't take a full breath, tightness or discomfort in the chest, waking at night, gasping, or needing to sit up to breathe. Many older adults ignore this, thinking it's just age or due to weight. But in reality, it's one of the most important symptoms to check early. Common causes of shortness of breath in seniors: heart failure. When the heart doesn't pump efficiently, fluid builds up in the lungs. Breathlessness during activity is one of the first signs. Coronary artery disease. Narrowed blood vessels reduce oxygen supply. It may feel like breathlessness, fatigue, or pressure in the chest. Lung conditions. Chronic obstructive pulmonary disease, COPD, asthma, or pulmonary fibrosis often cause shortness of breath during exertion. Anemia. When your blood lacks enough red cells or iron, your body doesn't get enough oxygen, so you feel tired and breathless even with small effort. Pulmonary embolism, blood clot. Sudden, intense breathlessness with chest pain or rapid heartbeat may signal a dangerous blood clot in the lungs. This is a medical emergency. What to do if you notice this symptom? Don't ignore it. Write down when it happens, how long it lasts, and what you were doing. Tell your doctor clearly. Say, I get winded walking 10 steps, not just I'm a bit tired. Ask for testing. Blood work, chest X-ray, heart tests, or a lung function test may be needed. If you have sudden, severe breathlessness, especially with chest pain or dizziness, call emergency services immediately. Final word: shortness of breath is your body's way of saying something isn't working right. It may be your heart. It may be your lungs. It may be something else. But whatever it is, don't wait. Breathing should never be a struggle. Especially not while doing the simple things you do every day. Symptom number 5. Frequent urination, especially at night. Waking up once to use the bathroom at night might not seem like a big deal. But when it starts happening 2, 3, or more times every night, it disrupts your sleep, drains your energy, and could signal a deeper health issue. Frequent urination, especially at night, called nocturia, is one of the most common, yet overlooked symptoms in people over 60. Many simply accept it as part of aging. But here's the truth. It's common but not always normal. And it may point to serious health concerns that can and should be addressed. What to watch for? Waking more than once a night to urinate, feeling a sudden urgent need to go weak or slow urine stream, feeling like your bladder didn't fully empty, increased daytime urination as well, new or unusual accidents or leaks. These signs shouldn't be ignored, especially if they're new or getting worse. Possible medical causes: enlarged prostate. Men, as men age, the prostate often grows, BPH, benign prostatic hyperplasia. It presses on the bladder, making you feel like you have to go more often even if there's little urine. Overactive bladder. Men and women, the bladder muscles contract too often or uncontrollably, causing sudden urges and frequent trips to the bathroom. Urinary tract infection, UTI, even without pain or burning. UTIs in seniors can cause urgency, frequency, and even confusion or dizziness. Diabetes. Frequent urination can be an early sign of both type 2 diabetes and poor blood sugar control. High sugar levels pull fluid from your tissues, making you urinate more. Heart or kidney issues. Fluid buildup during the day, in the legs, for example, may shift to the bladder at night when you lie down. This could be a sign of heart failure or kidney dysfunction. Medications. Diuretics, water pills, taken too late in the day may also cause nighttime urination. What to do? Track your symptoms. How often? How much? When? Any discomfort? Watch for patterns. Is it worse after certain foods, drinks, or medications? Talk to your doctor. Don't just say "I go often." Be specific. Ask about prostate exams for men, urine tests, or blood sugar checks. Consider a referral to a urologist if the issue persists. Final thought. You don't have to live around the toilet. If frequent urination is interrupting your sleep, limiting your outings, or causing embarrassment, don't suffer in silence. There are treatments, adjustments, and medications that can help. Your bladder doesn't control you. You deserve restful sleep and peace of mind. Symptom number 6. Sudden vision changes. Blurry vision when you forget your glasses. Normal. Gradual decline in sharpness over the years expected. But if your vision suddenly changes, gets blurry, dark, distorted, or partially disappears, that is a red flag. Sudden vision changes after 60 are never just age. They are a potential emergency. What to watch for? Sudden blurriness in one or both eyes, a curtain or shadow moving across your field of vision, seeing flashing lights or a burst of floaters, loss of vision in part of your field like a blind spot, double vision or visual confusion, distorted lines or shapes that used to appear straight. These symptoms can appear without pain, and that's part of what makes them dangerous. People tend to ignore symptoms when there's no discomfort. But your eyes are connected to your brain, and what you see, or don't, could be a sign of deeper problems. What it could be? Retinal detachment. This is a serious condition where the retina pulls away from the back of the eye. Without urgent treatment, it can lead to permanent blindness. Look for flashes, floaters, or shadows across your vision. Stroke. Affecting the visual center. If blood flow to the brain's vision area is disrupted, you may lose sight in one part of your vision. Often painless, but urgent. Macular degeneration. Common in older adults, it can cause central vision loss or distorted lines. The earlier it's caught, the more doctors can slow it down. Glaucoma. Sudden eye pressure spikes. Acute glaucoma can cause rapid vision loss, sometimes with pain and nausea. Chronic glaucoma progresses quietly, but also causes damage. Diabetic eye disease. Uncontrolled blood sugar can damage blood vessels in the retina, leading to bleeding, swelling, and blurred vision. What to do? Act fast. Sudden vision changes are always a medical emergency. Don't wait to see if it clears up. Some eye conditions get worse in hours. Go to an emergency room or eye specialist immediately. If you've had diabetes, high blood pressure, or heart disease, tell your doctor right away. Final word. Your eyesight is precious. Many serious eye and brain conditions can be slowed or reversed if caught early. But delay is dangerous. Vision that suddenly changes is never just a small problem. Don't take chances with your eyes. If something seems off, get it checked now. Symptom number 7. Chest discomfort or pressure, even without pain. When we hear heart attack, most people imagine crushing chest pain and dramatic symptoms. But in reality, especially in adults over 60, heart problems often start quietly with mild pressure, strange sensations, or discomfort that's easy to dismiss. Chest pain is not always pain. Sometimes it's just a strange feeling. And it can still be deadly. What to watch for? Pressure or tightness in the chest like someone is sitting on it, a feeling of fullness, heaviness, or squeezing, mild burning or discomfort, often mistaken for indigestion, pain or pressure that spreads to the neck, jaw, shoulder, arm, or back, shortness of breath, fatigue, lightheadedness even without pain, nausea, cold sweat, or a feeling of anxiety for no clear reason. These signs can come on gradually, may last just a few minutes, or come and go. But all of them may point to a heart in distress and require urgent attention. Why it's different after 60? As we age, nerves and pain signals don't work the same way. Many seniors, especially women and people with diabetes, may not feel typical sharp pain during a heart attack. Instead, they report fatigue, mild chest discomfort, trouble breathing, dizziness or faintness, a sense that something is wrong. That's why many older adults delay calling for help. They don't recognize the danger until it's too late. Possible causes of chest discomfort. Angina, reduced blood flow to the heart causes discomfort, often with exertion or stress. Heart attack, myocardial infarction, a blocked artery prevents oxygen from reaching the heart muscle. Heart failure, when the heart can't pump well, it leads to chest pressure and shortness of breath. Pulmonary embolism, a blood clot in the lungs, can mimic heart symptoms. Reflux or GI issues, sometimes misinterpreted as heart problems, but should still be evaluated. What to do? Never guess. If you feel chest discomfort, especially if it's new, comes with other symptoms, or happens during activity, seek medical help immediately. Call emergency services. Don't drive yourself or wait it out. Take aspirin if advised and not allergic. Sit down, stay calm, and wait for help. Final word. Not all heart attacks feel like pain, but that doesn't make them less dangerous. In older adults, even mild pressure or discomfort can be a cry for help from the heart. Don't second guess it. Don't delay. Better to be safe and checked than sorry later.